paying attention to what's happening out here with COVID. So buckle your seatbelts because we're going to have a really robust conversation tonight. I wanted to start out with just a little bit of information, a few items of overview for you so that you can see some of the stats in connection with what's happening with COVID. So let's pull up some of the stats, Shannon. We're really reiterating some of the things that we've had and we've talked about, and we've shown you some of this information in the past. And so this really shows us, our population in Lucas County and outlines, kind of the framework. And the next slide actually talks about the COVID-19 case by case count. And you can see for yourselves how all of the numbers break out and the number of cases and percentages of cases in connection with the pie chart to the left. And then the following slide actually shows us the death count by race. And so it's important to pay attention to the fact that, our communities of color, our Black and Brown folks actually are being impacted in a much greater way overall, when you look at the percentages as any other race. And so when we talk about vulnerable communities that are being impacted, we're talking about all kinds of vulnerable communities. And so, this evening, we really have a great panel for you. We've got some folks from a wide range of walks in our community. And so I'm just going to take a moment and introduce each one of you, give you a little bit about their background, and we will come back to the conversation. First, we have Lisa McDuffie, who is the president and CEO of the YWCA of Northwest Ohio. In the role for 24 years, the YWCA's mission is to work toward the elimination of racism and the empowerment of women. The organization operates in our community as the only emergency domestic violence shelter and rape crisis center. The YWCA strives to provide permanent supportive housing for formerly homeless women and their children. They provide pregnancy prevention education in all Toledo public schools, childcare resources, and referral services for parents and childcare providers, as well as breast cancer education on early detection against breast cancer. So Lisa, welcome. We're glad to have you a part of this.
Thank you, Wendy. I appreciate being here.
Absolutely. Deb Flores, Chief Executive Officer of Zeph Center. Deb has dedicated her career to providing services to the vulnerable people of Northwest Ohio. Joining Zeph Center in 2013 as the Chief Operations Officer, she's also served as the Chief Executive Officer since 2017. She continuously evaluates and updates the organization's missions, goals, strategies, objectives, and action plans in order to find new and better ways to make a significant difference in behavioral health science. Deb's responsible for the recruitment and retention of mental health medical providers, as well as the development and coordination of organizational policies and procedures to best serve Zeph's clients. Prior to working for Zeph, she worked for Lucas County Department of Job and Family Services from 1999 to 2013, where she served as the executive director from 2006 until 2013. Deb, welcome. Karen McConnell. Awesome, thanks, Deb. Karen McConnell is the Director of Mission Services for Goodwill Industries of Northwest Ohio. Karen is a 1990 graduate of Notre Dame Academy, go Eagles, and a 1994 graduate of Miami University in Oxford with a Bachelor of Science degree in psychology. She obtained her Juris Doctorate from Case Western Reserve University School of Law in 1997 and passed the Ohio State bar examination the following year. Karen maintained a general practice from 1998 to 2007, representing clients in the areas of criminal defense, civil litigation, domestic relations, personal injury, bankruptcies, real estate transactions, and business organizations. She is a former Toledo City Councilwoman, where she was the president pro tem, and has served on many and numerous community boards throughout the state of Ohio. Karen has a passion to work in the field of reentry and helping returning citizens, particularly women, discover a sense of hope and purpose in shaping their futures post-incarceration. She is now in a position to touch lives and empower people with her testimony. Karen currently serves as the president of the Re-Entry Coalition of Northwest Ohio's Board of Directors and vice president of the YWCA Board of Directors. Karen, we're glad to have you here. And last but certainly not least, to round out this great panel, we have Dr. Larry E. Hammy. Dr. Hammy was born in North Carolina and moved to Toledo, Ohio in 1971. Received his bachelor's and master's degrees from North Carolina Central University in Durham, North Carolina. He received his PhD from the University of Toledo, becoming the first African-American to graduate from the doctoral program in psychology. He is the former chief clinical officer of Unison Behavioral Group, and now he's in private practice, where he's the proprietor of Larry E. Hammy, PhD and Associates. He specializes in family therapy, but also treats couples, children, and adolescents. He's also conducted numerous workshops on a wide variety of topics. Dr. Hammy, welcome.
Thank you. I'm really happy to be here.
Awesome. So everyone, we have so much to cover this evening, but I want to take a moment and I want to give you each the platform to kind of talk a little bit about your organizations and what you're doing in this community before we kind of jump into a few deeper issues. So I'm going to start off with Lisa McDuffie, who again is the president and CEO at the YWCA of Northwest Ohio. Lisa, take it away.
Thank you, Wendy. Again, it is a pleasure to be here with such a distinguished panel. And it is a pleasure for me to be able to share what we're doing at the YWCA of Northwest Ohio. We have actually been in the community for 150 years. As you mentioned, we have an array of different programs and services. But when we are really talking about vulnerable populations, what comes to mind, quite frankly, is our domestic violence shelter. It's been around since 1979. We have 17 rooms, 28 beds. And many people believed when the governor shut down the state that our shelter was also closed. Incorrect. We were open. We are open today because we are the only emergency domestic violence shelter. We know that, in fact, domestic violence would not go away as a result of a pandemic. So it's important for people to know, if you are in a domestic violence situation, that the YWCA is available and welcoming you into our agency. We provide a variety of services. I'm a real avid person who's advocating on behalf of all of the facts that the CDC is encouraging us, as well as our local government, with social distancing to help prevent the spread of COVID. And so we have organized some plans and have implemented them so that individuals have private rooms and have the ability to stay safe. So again, I just want to encourage people to utilize the service if they need it. It's a well-known fact that the majority of individuals that experience domestic violence are women, about 95%. And every 5 seconds, there is a victim of domestic violence in this country. So it's important for us to not forget about individuals that may indeed be experiencing domestic violence, which, takes, again, a total array of different types of abuses, which, maybe we can come back and talk about a little later.
Thank you, Lisa. I really appreciate that backdrop on the YW, doing such great work here. Deb Flores, I'm going to shift over to you and let you talk a little bit more about, the Zeph Center. I've given a little bit of insight in connection with your bio, but why don't you tell us a little bit more about the work of the Zeph Center here in our community?
Thank you again for the opportunity to spend some time with folks that I haven't seen in a while. And it is really just great to talk about what we can do as a community to support people. When I listened to Lisa talk about the trauma related to domestic violence and thinking about the young people that are at home and maybe witnessing this, So the Zeph Center offers services that range from young people to the elderly. And so we provide mental health services that could include therapy, it could include psychiatric services, and we also have a youth runaway shelter. So when Lisa said the shelter stayed open, our youth runaway shelter also remained open, and it still continues to be open because we are the only youth runaway shelter in Northwest Ohio. And then you think about adults that are at home. What we know is isolation is difficult for everyone's mental health, and it's also difficult for the recovery process. So we have services for adults that include mental health, therapy services, psychiatric services, and then we have the addiction treatment that is part of our umbrella of services. In addition to that, we support people with employment and job coaching. And so we know that as things start to reopen, some jobs may not come back in our community. So how do we retrain and help people through that loss of their livelihood, for example? Sometimes relationships may suffer from this pandemic, and definitely financial stress for families. So we also have the ability to assist with coaching people and helping them find employment. So there's a big umbrella at Zeph, and I'm here to talk that we are creating hope and that people can recover. So thank you for my opportunity to speak, and I'm happy to answer any questions. I want to give Dr. Hammy and others a chance to talk as well.
Absolutely. Thank you, Deb. That's great, and a wonderful overview of all the things that Zeph is doing. I want to shift over to Karen and talk a little bit about, Goodwill and all of the work that you all are doing here in our community. So Karen, why don't you chime in and give an overview of what's happening?
Will do. Good evening, everyone. So I am the Director of Workforce Development at Goodwill Industries in Northwest Ohio. When people hear Goodwill, you typically think clothes that you're donating or that are being sold in our stores. And the whole purpose of our whole business model is those donations turn into support for our workforce development services. So traditionally, across the country and internationally, Goodwills help individuals who are low income and who need employment and training opportunities. That is our mission. We have kind of carved out a little niche here that has a large focus on reentry. We help individuals who have disabilities. We help older individuals who are 55 and up and need training and employment. We help women. We have a summer youth program working with OOD, but we have a very strong reentry program, and that's sticking out in my mind now because of what's happening with COVID-19. When this first started, my very first thought was, what's going to happen to all of our clients or future clients who are incarcerated or coming out of communal living? And I'm sure we'll get more into that later, but returning citizens aren't always looked at as human or aren't always understood to have the same feelings and emotions and even different issues that we have. So our passion has been to really just try to make sure that they can re-enter society seamlessly, be seen the way that they should be seen, have a voice and be heard, and be able to work and raise their family and feel as if they are part of a community. So to that end, we have a couple of grants that are funding opportunities for us to help returning citizens. One is a federal grant from the Department of Labor, and then we have a grant that will start next month from the Department of Justice. And this is targeting individuals who are yet incarcerated. We will begin services while they're still inside and then continue once they come on the outside. And then we have a smaller program that is helping individuals with anything that is workforce or and educational related. So barriers to employment that could include license reinstatement fees or work boots or just having a birth certificate or state ID. We can help them obtain those things so they can actually be viably employed in the community. So we do a number of things, but one of my passions obviously is reentry. So I'm happy to talk about it and answer any questions anyone has.
That's great, Karen. We're going to post your cell number, so all those folks that need some help, they're going to be calling. So look out. That's a great backdrop because when you think of some of the impacts that have taken place, a lot of folks unemployed, a lot of folks just trying to struggle. Our organization provides meals for kids, and we've just started providing food boxes for families, and so you have a wide swath of impacts that are happening to folks in our community. And so I want to take a moment and talk with Dr. Hamey and have him share a little bit about, his practice and his organization that really focuses on family therapy and others. So tell us a little bit more about Larry E. Hamey and Associates.
So I'm very happy to be here tonight, working with all the esteemed guests. First of all, I'm semi-retired, but I've spent a number of years working in both the Community Mental Health Center, and I'm a former president of Goodwill. I spent about 35 years at Unison in various capacities, and I left as a chief clinical officer. And I'm now working roughly about 15 to 18 hours a week, which is just about perfect for me. Mainly what I do now, I've done a number of different things over the years, and I spend a lot of my time working with families and adolescents and kids. And one of the things and I'm going to talk more about some of my experiences with the coronavirus and the impact that it's having on the community as well as the world. But one of the things that I work a lot with minority families, but I see anybody that needs the kind of help that I can provide. And one of the things that I do is I specialize in learning. And a lot of the problems that we have as adults has come about largely because people have failed to learn proper techniques, or they've been exposed to deviant models and they've learned things that are maladaptive. And so part of my thing, especially when I'm working with parents and kids, is to teach them different ways in terms of how to manage and to alter behavior. A lot of the parents that I see, they have very limited number of responses in terms of how to go about changing the maladaptive behaviors of the kids. And so part of my job is to teach them new techniques and to be able to sell them the idea that basically the things that they may have been doing, if it's not working, then it's time to try something different. And a lot of times the problems that the parents are having have come about because of deficiencies in terms of the kinds of people that they probably needed to have made some kind of learning requirements, and that failed to happen. So part of what I need to do when I'm working with both kids and families is to create an atmosphere where people are willing to try something different. And sometimes it's not that easy to do. Other times, if a parent has been stuck into a certain mode and things are getting worse for them, usually if the misery index is pretty high, they're much more likely to want to go about making those changes. With kids, on the other hand, coming to see a psychologist generally is not one of the favorite things that they do. Oftentimes they will come in and they will say something like to me, well, I'm not mental, meaning that they're not crazy. And so part of my job is to let them know that most of the people that I see are not mental, but they're having problems in terms of adjusting to life. And so once again, I'm going to be working with them to help them understand that. And I ask the question very simply, do you think you need to be here? And almost invariably, they'll say no. And then I will point out some of the things that the parents may have said to me about them flunking school, or they've been arrested, or they're doing drugs, or they're selling drugs. And I'll say, what do you think is going to happen to you if you continue with these kinds of things that your parents have told me about you? And so usually at that point, they will start to see, and I will share with them, I've worked with lots of juvenile delinquents and a lot of gang members over the years. And I will share some of the stories about some of the kids that I've worked with. And sometimes the outcomes have not been very good. And they have an opportunity working with me now to avoid going down some of those toxic paths. So, I love what I do. I love being a psychologist, and I learn something from every family and every kid that comes into my office.
Great. I mean, thank you for that information on your practice and your work. You touched on, just mental health and some of the the challenges. So let's dive a little deeper into COVID and the impact of that, of COVID. Deb, I want to start with you and, you know, Zeph Center and the number of services that are provided. Talk to us. What are you seeing as it relates to the impact of COVID on the folks that are walking in the door at Zeph Center?
So I think we have to think about some of the ways that we had to reinvent or pivot is what we've been using our services, because we were considered healthcare, but somewhat social services. And we had to close a few of our buildings and we had to move to a telehealth platform. We were able to keep multiple buildings open, but we have quite a lot of property. And so finding the balance of being able to support our patients and keep them safe, as well as our staff. So we had to figure out a new way to work with our patient population. And so what we found, for example, if we mailed out 420 applications for, or not an application for services, we might have received about 200 of them back. So when somebody calls and asks for help, you got to be able to respond quickly, because they have that moment, they have that need, and they're willing to take the next step. So we had to figure out quickly how to be accessible. So we did still have staff that were going out into the field. And so some of the things that we're experiencing is our own staff is having trauma related to the change in their life. Their kids are no longer in school, but they're supposed to work full time, and they're listening to patients who are isolated. We had a patient who was on the phone who said at that moment they were suicidal and they had intention. So to coordinate 911 to deploy them to someone's home and to keep them on the line and keep them safe, it's a little tricky. And so we do know that we're seeing an uptick in suicidal ideation because people are isolated. They don't have the normal support systems in place. They are feeling hopeless, and there's just fear. If I get sick, what will happen? Who will take care of me? How will I handle this? And then a lot of the I would call them like the checks and balances. When you have to drop a urine and you're being held accountable for your treatment, and it's not as robust as it should be because the federal government changed a lot of rules related to treatment, you kind of slack a little bit. So we saw an increase in patients that were overdosing and needing detox services and outreach. It's just been very, very difficult for people. And to underestimate, if we think everyone stayed at home and everyone was just fine, is not the reality of our community.
And Deb, you know, everything you're saying, it's like there's this stressful blanket that is just hovering over our community, you know, our county, our state, and our world. And so some of the things that you pointed out are, you know, part of what we need to really have greater discussion about in our community. Dr. Heaney, I think you were going to jump in and share a thought.
Well, I wanted to talk a little bit about I'm sorry, was it me?
I thought you had a comment to what.
Yes.
Deb.
Okay. I didn't know if I was cutting Karen off, but anyway, yes. Part of what I'm seeing here with the coronavirus is, and Deb just talked about this a moment ago, is that this thing has impacted people in such ways that it's really traumatic to them. It's traumatic in lots of different ways in terms of people have lost their jobs. Everything that they've been accustomed to has gone awry. And so part of what I deal with is trying to help people understand that everybody is in this boat and adjusting to the new reality. And unfortunately, the new reality is not firmed up yet. Every week and every month, things change. And that's caused a lot of difficulty for people. Two of the things that I see the most when you're dealing with a traumatic situation we're talking about this is a consistent, continuous trauma that it doesn't go away after like a hurricane. A hurricane may come and 3 or 4 days later, everything is over. But this thing has persisted for weeks and months, and there's really no end in sight. And so it really makes it really difficult for people whose schedules have been changed. Their jobs many have been eliminated, and they are coping with things. And two of the things that I see most often are anxiety and depression. And the kids, of course, they're bored, and a lot of times the parents don't know what to do. They are worried about their income or their security, or will their jobs be able to return? And these are the kinds of things that not only affect you psychologically with anxiety and depression, but these kinds of constant stressors can actually change your physiology, so that if you have some underlying condition such as an ulcer or migraines or whatever, you see an uptick in the so-called psychosomatic disorders. So there are things that happen here with the coronavirus that impact us both psychologically as well as physically, and those are the kinds of things that many people are having to deal with. And so we talk about some things that we can do to try to help them understand everybody is impacted by the coronavirus. Unfortunately, some people have less resources than others, and those families that have less resources, they are impacted more adversely, and it causes all kinds of additional stressors. Some of the figures that we saw at the beginning of the program tonight indicates that people of color, the minority individuals, have much higher incidences of the impact of the virus, and it affects us both financially to a greater degree than others. And so part of what I end up doing is trying to help people understand that even though this is an inconvenience, but if you can stay healthy, that things will settle down, but they may not be the way they were, say, 4 or 5 months ago or a year ago. But that's part of what the human condition is about. Before 9/11, people would go to the airport and jump on the plane, but it's never going to be like that again. But people have made that adjustment. And what we're dealing with here with the coronavirus is very similar to some things that will change our future permanently.
So, Dr. Hemi, those are all great points. And, you and Deb really underscored the stress, the difficulty, the challenges. And so, Lisa McDuffie, talk to us about domestic violence and what you're seeing as a result of COVID. Are we seeing more instances? Are we seeing fewer instances? What are you seeing at the YW?
Yeah, I would love to. I just want to make one quick comment really on the coattail of Deb and Dr. Hamey. Another vulnerable population that is important to recognize is our young people. There are young people who are experiencing everything that we just heard my two colleagues talk about. And it's only coming to them in a little bit different shape and form. When we first learned about COVID-19, we all believed if you weren't traveling internationally, if you hadn't necessarily left the States, if you weren't, over the age of 60, that coronavirus was not something that was going to be in your life and affect or disrupt your psyche. And now we know all those things not to be true. And so helping young people understand even the abruption of being displaced out of their school settings and trying to stay focused to still learn when there was some online education trying to be taught or instruction. I mean, it has been also very, very difficult for them, not to mention the fact that especially if they were children of color, chances are they know someone that was affected and possibly died. And so, we want to stay mindful of remembering all the services that we are trying to provide, making sure we are carving that attention out for young people as well. So I just wanted to jump in, and it's one of those formats where you don't know if you can raise your hand or pop back up on the camera. So I wanted to share that part.
No, that's great, Lisa. Thank you. We appreciate you adding to that. And then I know you're going to hit on a couple of points about
Yeah,
just domestic violence as well. But thank you for pointing out that our young people, our kids and our youth, they are feeling this impact. They're not oblivious to it. They're feeling this
yeah,
every
absolutely.
as much as we are.
Yeah. So in terms of domestic violence, it's unfortunate that domestic violence is here and amongst us. And there are obviously signs and symptoms that people need to know and be mindful of when it comes to even dealing with domestic violence, even more importantly, even speaking out against it. And so there is a slide. If we could go to the slide that actually talks about, am I a victim? Okay. So I'm not sure. Let's see. That's not it. There should be another one. That's right. Why don't I just keep kind of going? So here's what's important, and that slide there is just fine. But there are obviously different forms of abuse, and many people, quite frankly, believe that abuse is simply being beat up, slapped around, that sort of thing. But there are many, many other forms of abuse that is of equal nature and sometimes even more detrimental. They are listed there on the screen. It can be from being forced to do sexual acts, to being criticized and blamed and name called. But one type of abuse that many people do not always recognize that is very demeaning is that of financial abuse. And that is really when the intimate partner withholds money from the individual. In some cases, people come to us and they say, I work a job, but I've never seen a paycheck because my perpetrator or the abuser instantly takes it from me. There's another angle of that, in that sometimes we have extremely educated individuals that have wonderful skills, but they cannot keep a job. And the reason why they can't keep a job is because the abuser does everything in their power to disrupt that person's ability to be to work on time, get their work done. They may take the car away from them, knowing that they need to be there. And, we could go on and on and on and even talk about psychological things where perpetrators will threaten to do things to pets or not provide for the children. So these are really ways that, in again, most instances, women are trapped and feel as though they need to stay in a relationship. So our agency, even during and in the midst of COVID, really have been trying to get the word out and let individuals know that if you are experiencing any of these forms of abuse, to please contact us. Please, please, please. We can help you with a safety plan. If for any reason you're not just at that particular moment ready to leave, we can at least help you with that safety plan to do everything in your power to be safe. We like to help individuals come up with passcodes or codes that they can share with a loved one or friend. It may be something as simple as, when are you going to make my special dish? Or, oh my gosh, I love that shirt. I actually have seen various commercials where the woman is actually ordering a pizza, but she's calling 911. Those are things that we like to help individuals know that is important to know and be able to talk through with other people. Bystanders are equally as important. And the bystander really is a neighbor or a relative or someone that believes or has a suspicion that a person is being abused. It is the same kind of moral obligation of what we like to say, credible to what we do for children. If you are aware of an abusive situation, we urge you to call the police. Many of our women come in and they say, I was victimized in my driveway. My neighbors were out taking out their trash. They saw this person hit me and they turned around and walked back into their home. Those days of not speaking up on behalf of individual victims are long gone. We are encouraging people to please, please do their share to ensure that there are no more deaths that occur, in particular in our country, in our community. But understanding that even as COVID is amongst us, I mentioned this a little bit earlier. At one point, we used to double up in our rooms. We are no longer doing that really to prevent the spread. Each and every person that comes to the shelter has the ability to be tested to determine if they are negative or positive. And if they are positive, there are arrangements we have with our county to provide safe care as well as medical care. And if you are negative, then all of the services that I've been talking about is available to you. There is a slide that also references our crisis line. If you could put that slide up so people can take note of it, I would appreciate it.
Yes, and that crisis line is 419-241-7386. 419-241-7386. Be sure that you are heeding this information, sharing that crisis line, so that those that are dealing with this can actually get the help that they need. So thank you, Lisa. We appreciate that. We all know COVID's had a huge impact on employment and what's happening, in addition to all of these other ramifications that we're talking about today. And so, Karen, let me swing over to you and let's talk about the, Goodwill's Job Connection Center. And, we talked a little bit earlier about the reentry program, but let's talk a little bit more about the Job Connection Center, because people need to understand and know, that this service is out here. It's available as employers start to hire folks back and potentially find new opportunities. Talk about how this Job Connection Center can help people in our community.
My pleasure. So we have two Job Connection Centers. If you can see, one is at DeVoe, or DeVoe Village. So there's the store, there's donation station, and then right next to it is a Job Connection Center. And the other one is at our main office downtown, which is right inside of our administrative building. So the whole point of the Job Connection Center is to basically connect employers with job seekers. It's really that simple. That sounds simple to us, but when you have someone who is job seeking, maybe for the first time or for the first time in a very long time, it is just not that simple for them. And one of our concerns right now is having individuals dealing with COVID. And Lisa she alluded to it, and I'm going to point it out a little bit more. They're grieving. A lot of people are in a grieving process right now. And so trying to find or maintain employment while you're grieving, while you're dealing with fear and anxiety, can prove to be extremely difficult. So our approach is not to just you walk in the door and we're forcing you into a job or trying to make sure that that's the only thing that we're helping you with. We really need to understand where they are holistically. Understand, what are you dealing with? What are your fears? What is your skill set? What can we hone? What can we skill you up in? What do you really want to do moving forward? And understand we may have to take a few steps backwards with people to get them to move forward because of all that they're dealing with. So I just want everybody to understand, when people come in the door, it's not like we're throwing job opportunities at you and saying you have to get employed right now. We want them to understand, go at your own pace. Let's help you with some skills. Let's resume build. We can do some job readiness training. And then when you're ready, we will be there to hand you off to an employer to walk you through the whole process. And one thing that we're very good about is we stay with our individuals. So even once they are employed, we don't just say, okay, great, we check a box. That was a number that we were able to meet. We actually stay with them. We're available for them to call us. If there's a problem on the job site, we can troubleshoot. We do spot checks to make sure that they're okay and have what they need. People fall on hard times even after they're employed. So transportation comes up as an issue. If they're experiencing food insecurity, whatever the case may be, we still try to help them troubleshoot even after they're employed, because that's not the be all end all for everyone. And we understand that now more than ever. So that's what our Job Connection Centers really are about. It's providing training, job employment training, and then helping individuals identify positions that they want and going after them, matching them with a good employer.
Well, Karen, that's great. And we can see right here on the screen that there are a couple of different locations for the Job Connection Center, one downtown, one in a DeVoe location off of 2600 West Sylvania Avenue. So this information that you're seeing today will actually be on the Lucas County Health Department's website following our session and as part of the session. So you can go and visit that information to find out more about the Job Connection Center that Goodwill is offering for our community. Deb, I want to talk with you for a moment and ask, what can we do to support an organization, like Zeph Center? How can the community get involved and lend a helping hand?
Well, I think at this moment, what's important is that we don't stigmatize people asking for help. Oftentimes I'll hear people that'll say, well, you shouldn't take medication. That's not good for you. And I said, so if someone was diabetic and needed insulin, it would be okay for them to take it. Well, yes. So if someone needs an antidepressant to help them feel better about their life and themselves, then why is that different? So I think stigma is really, it's important to help people connect to treatment, whatever that treatment looks like for someone. We have couples that come in that might have marital troubles. They might need a 12-week session with a therapist to help them work on their relationship and how they keep their marriage alive, or maybe they make a decision that they're not going to stay in a marriage. But there's something different for everyone. And I think it's important that people are not just quarterback couch therapists and give advice. Oftentimes you'll see things online that are not really professional kind of support. So I think that we have to keep in mind that right now it's very, very difficult for people. Not just COVID, we know that in our communities are hurting, especially our African American community. And we need to support each other, and we need to understand why we're at the moment that we are in, and how we can reflect and make the connection to care. That oftentimes friends get fatigued with each other when they complain about where they might be in their life. So talk to someone that's willing to be a listener and to give you good support and advice. And so I think that the stigma has to go away. We have to not say that people are weak. They should just be able to quit drinking. They should be able to quit using drugs. It's not that simple. Dr. Hammy touched on the psychological impact it has on people when the brain starts to get altered from addiction, or people sometimes have different trauma that makes it difficult for them to get up and look for a job. So we all have to stop judging each other and try to connect people to the right type of care that they need.
And Dr. Hamey, on the heels of that, share with us maybe something that if a family is struggling and they are dealing with grieving, and they are dealing with the trauma, they are dealing with the fear, all of the things that we know, and so many more things that people are feeling right about now. Talk to us a little bit about what those families can do. You got to turn your mic on. Turn your mic on so we can hear that wonderful advice that you are going to give us. We want to make sure you have your mic on.
Okay, how's that?
There you go. We got you now. We got you.
Okay. I wanted to follow up a little bit what Deb talked about with stigma. One of the big issues that I run into, and all of the mental health providers, is the role of stigma. And especially as it relates to, first of all, to the title itself about having some type of mental health disorder. And secondly, with medication. If I see one thing that's really, and everybody doesn't need medication. If you have some, reactive depression because you didn't make the baseball team, you don't need medication for that, right? Somebody can help you, look at things differently. You need to train harder or whatever. But there are certain disorders where it's a brain disorder, right? And a lot, I don't expect the lay people would understand this necessarily, but they will come in, and I don't just try to get them on medication. I usually give them some type of assessment to determine if there's something present, and if so, how much. And medication is one of the big barriers that I deal with on a day-to-day basis, right? And so it's a matter, what Deb had talked about earlier. If you had diabetes, you wouldn't have any problem, doing insulin or going to see a specialist, right? So medication is indicated for a lot of people if they're suffering from really serious disorders, including depression, schizophrenia, or what have you. The other thing that I try to do with the individuals that are having these kind of traumatic situations is to help educate them about some things that they need to do. Now, one of the things that we need to learn from this pandemic is that African Americans, and people of color, and if there's something bad that's happening out there, we're going to get it worse than anybody else, right? And we've seen how this virus has caused many, many more deaths percentage-wise for people of color. And a lot of that has to do with we have these underlying conditions in addition to the things that we are being exposed to. But a lot of times, and this is especially true for African-American men, they won't go in, they won't go in to see the doctors. I mean, honestly, I can't tell you how many, for example, like a prostate exam. I know it's an unpleasant encounter, but it's hard for me to get them to do these kinds of things. So I work really, really hard to try to help them understand you need to be checked out physically as well as psychologically. We want to help them understand that, if one of the things I say, and this is kind of, I don't know if it's a new idea or not, but when I'm working with the parents, and we've got some really, really hard working parents, and they're working uphill almost constantly. Sometimes they have 2 and 3 different jobs, right? But I say to them, look, when you're flying, one of the things that the flight attendant is going to say to you, in the event that you need oxygen, put your oxygen mask on first. And I say that to my parents, right? And I know that they do everything they can for their children and for their spouses and whatever. But what I'm really trying to get them to do is to take care of themselves first, because if they go down, so goes the family. And so what does that mean? I really try to have them find something that they look forward to do. And it doesn't have to be something they can do every day, but at some point that they have, whether it's to take a hot bath or whether they go out and play bingo, but something that they can do where they can unwind instead of being in this constant state of arousal. And when people are exposed to continuous stress, right, your thermostat really gets stuck. You get stuck in this mode where your blood pressure is up and it doesn't go down. Your body is secreting all kinds of hormones that will actually help deteriorate your body. And so what I really try to do is to help them understand that if this family is going to survive, they've got to make some changes in their lives. And I try to get them to do something, if they're dealing with anxiety and depression, to try to get them to do some kind of activity. The weather is now getting good, so if you can get out and walk in the park, and sunshine is a great alleviator for depression. To try to get them to do things that are different, some things that are healthier, and also to try to develop healthier eating habits. And I know a lot of times we don't have the resources, but if you can buy things, and we eat a lot of times comfort foods, right? Because we're stressed and we're depressed, and you end up eating a lot of foods that are only going to make us sick, especially if you're eating foods that are high in caloric value. And so I try to work with them, and the doctors they're really good. If you go see your primary care doc, and if you're a little bit overweight, they will give you some materials to help you eat better and to prepare better and healthier dishes. So I try to get them to do things. One of the things that people have had a lot of difficulty with lately is, they're short on things, and there's nothing wrong with asking for help. And if you can do something, if you can help somebody else, sometimes that is a very therapeutic thing to do. But don't be afraid to ask for help if you are short on something, right? And I try to get people to stay in contact, because, we were talking earlier about one of the impacts of the virus has been that people have been isolated, that they're cut off from their normal support systems. And so one of the things that has happened, and I suggest to parents, or families, try to stay in touch with somebody. Call your neighbor, call your grandma, even though you may not be able to go visit them. And a lot of families have started to develop these contacts where they have these group text messages, right? So people are doing that kind of stuff. And everybody may not have a cell phone, right? But if you can do something like that where you can stay in touch with people, check on people. And the other thing about doing those kinds of things is that a lot of times everybody's in the same boat. And if you talk to some of your church members or whatever, they'll deal with the same kinds of problems. And sometimes they have solutions. They have different kinds of solutions. So when you do those kinds of things, you can come up with some remedies. Plus, you stay in contact with people and find out how they're coping. There's lots of wisdom and power in group context. So those are some of the things that we can do to try to cope with this ever-present virus.
No, thank you. Those are all very, very helpful items. I do want to swing over to Lisa McDuffie very briefly. Dr. Hamey was talking about, all of these wonderful things that people can do, but he was talking about how oftentimes men don't want to go to the doctor. But I want you to just touch on, the service that the YW has in connection with breast cancer education and early detection. Talk a little bit about that service that you all offer.
Absolutely. Our breast cancer education program is there for underinsured and uninsured women to get them linked up to a healthcare provider to get a breast cancer screening. We work with a variety of providers in Northwest Ohio that provide pro bono services for a clinical breast exam as well as a mammogram. And if the outcome of the screening is negative, when we keep them in a tickler system and we contact them annually, because once you begin your screenings, we want you to continue them. But if for any reason there is an abnormal reading, our staff really holds the person's hand all the way through the process. We are there to make sure that individual understands what the doctor is encouraging them to do, whatever the treatment options are. Sometimes the outcome may be, there's something there, you need a biopsy. So we want to make sure that women understand the importance of doing that. But the fact of the matter is, just as Dr. Hemi alluded to, oftentimes there are mindsets, in particular in women of color communities, that take a position of taking care of everyone else, putting themselves last. And then there are some folks who believe, I shouldn't be touching my body, so I'm not going to even feel around to see if there's anything abnormal today compared to last month. The encouragement is that all women should be doing self-breast examinations. Most physicians will talk with our ladies about that and making sure they understand and know what they're looking for. And if indeed there is a diagnosis of cancer, our staff is able to, again, make sure all of the options that are available to them are explained. It's an unfortunate situation. We think about what's happening today in the course of what's happened in the last week with the murder of George Floyd. But I just have to go here for a second, because the healthcare industry for a very, very long time, over the course of more than 400 years, hasn't been a color. And so there's a distrust of the healthcare system. And a lot of times women will come to us and they will say, I don't feel comfortable going to a doctor on a regular basis and getting an examination. I don't want them to do something to me that's going to make something worse. And so we've got to distill and debunk those myths. We have the ability to be in the room with individuals as doctors and healthcare providers are explaining the end results as well as treatment. And so we're there to advocate. It's allowed a great opportunity, I believe, to save many, many lives. That the women are able to accredit really the strong voice of the advocates in our program. that has helped them and more importantly, even helped their family understand the importance as well.
Lisa, thank you for that information. I mean, we are getting Facebook folks. I hope you all have your notepad out and you've taken a ton of notes. There's some really rich information that's being shared here by these leaders of organizations that are doing just amazing work right here in our community. I want to circle back for just briefly. Our time is kind of winding up, but I want to circle back to you, Karen. You know, we're in this space of the need for social distancing, and we know that, you know, not everyone is back at the office, and you know, we sometimes know that places are shut down. So with the Job Connection Center, talk a little bit about that. I mean, is it open? Can people do face-to-face interaction? Is it virtual? How can people connect through the Job Connection Center?
Oh, yes, and all of the above. We are open to the public. They can walk in or they can call and make an appointment at either location. We do practice social distancing, and we have virtual viewer on our the manager's desktop. So if they need assistance, we can do that from afar and not have to be in their breathing space. Our staff is wearing masks, and we will keep our distance accordingly. And hand sanitizer is also available, and that's at both locations. We are offering virtual services as well. We are doing Facebook Live sessions and Zoom sessions, and we even had a virtual job fair last week, and we will continue doing that throughout these times. And we will actually have an in-person job fair that will be social distance, and we will have barriers in place, plexiglass barriers in place, and that will be at DeVoe on the 16th of June, and that is to staff some of our Goodwill positions that are open in the stores and in the warehouse and on commercial contracts. So we will post that information on our Facebook page, our Job Connection Center Facebook page, and we will have it on our regular Facebook page as well.
Okay, that's great. And I know a lot of folks that are, you know, out of work and looking for employment, they value that information. Deb, I'd ask you to jump in a little bit and talk a little bit about Ohio Means Jobs and what opportunities might be available to job seekers in connection with Ohio Means Jobs.
Absolutely. Thanks for asking. We are currently, the ZEF Center is the administrator for their operator for the Ohio Means Jobs, Lucas County. So we have moved also, very similar to what Karen's talking about, to a virtual platform and helping, actually we've been helping the state of Ohio kind of triage some of the unemployment questions and challenges people are having with that system. And Lucas County is committed to providing the online resources to help not just the job seekers, but the employers. There are many new jobs that are in demand, and we're helping them find the right fit. We can screen the applicants, we can do virtual training and the same type of things that we need to do to help people be successful in the job search process. We're doing some virtual trainings as well. We have some additional federal grants. So if people are looking into maybe a different line of business, some folks are saying, I've tried these things, and with COVID, it's an opportunity to reinvent myself or to find different type of employment that might have a different level of stability. And we can help them through that career search process. And so we're excited. We partner with many people through the Lucas County Ohio Means Jobs.
Great, thank you, Deb. Ohio Means Jobs, as well as the Goodwill Job Connection Center. Those are a couple of resources for folks in our community. If you're looking for a job or your employer that's looking for great workers, these organizations are going to make sure that you get paired with the right folks. And we talked a lot about and heard a lot about resources. I cannot allow us to leave this conversation without us talking about, you know, one very direct way in which resources are committed to Toledo and Lucas County, and that is through the census. And that takes place every 10 years, and that's a lot of time in between when that information is gathered. And so, you know, population determines a lot of the seats that we have in Congress and our electoral votes and all of that, but also how the federal government decides, you know, how to return our tax dollars into our community. And so, Shannon, if you can bring up a couple of those slides for me. We've had not so great responses in the past. You know, some of the census tracts in Lucas County have a response rate as low as 30.6%. And so we need to recognize that, you know, completing the census information, it's very simple, it's very straightforward, is going to help us. And it supports schools, healthcare, emergency response support services. Those are just a very small few examples of how the resources that are calculated based on the census get redirected back to our communities. And so when we talk about what happens when we don't do it, there's about $1,814, as you see right here on the screen, if you do not, for every single person, when we don't make sure that everyone is counted every 10 years. And that's huge. That's a huge amount of resources. And I know every single person on this conversation today, you know, if our organizations can get some additional funds to do the work that we do, it would mean a world of difference. And so right now it's never been easier. Never been easier. But this screen shows you how many, you know, what's been lost. We lost 16 congressional seats, and it's all because we are not completing census information. And so we're encouraging you to make sure that you complete the census information. Like I said, it's never been easier. You can respond online, you can do it by phone or email, you can do it all without social, you know, with social distance and not missing any folks and all that fun stuff. And so, you know, if we don't do this, it's $1,800 per person per year. So when you start calculating what the impact is, the financial impact, it's great, it's huge. And so we have the information posted here. Again, this information will be on the website, Lucas County Health Department, and you can come back and take a look at that at another time and make sure that you avail yourselves of this information and complete your census. You know, we've gotten some incredible information from our panelists today, Dr. Hamey, Lisa McDuffie, Deb Flores, Karen McConnell. I mean, you guys have really shared some valuable information today, and we really appreciate all of the time together and the conversation. And we want to just make sure to remind you of our next and I believe final installment of these conversations, and that's going to be June 11th at 6 p.m. The impact of COVID on small businesses, moderated by the lovely Ambria. And Ambria is going to be doing that and doing a great job of that. And she is the owner of Arc Restoration and Construction and does a great job. And her panelists range from Roy Hodge, Lenora McIntyre, Rhonda Sewell, and Bill Warsaw. And you don't want to miss this. This is going to be a great event. It's going to give you some additional information. They're going to share tools, resources, and all kinds of information about the impact of COVID on small businesses, but not just the impact, but they're going to share with you some tools and some resources to improve your position. And so I want to thank everybody again this evening for being on this call. Thank you, Facebook folks, for being on and sending us your questions and joining us. And I am just wishing everyone a wonderful, safe, and blessed evening. Take care.
Thank you.